Good afternoon, everybody, on this rainy Monday. Just want to do a quick daily health update. Today, I want to just take a second and talk about low back pain. It's probably the most common thing other than car accidents in terms of what we treat here at Spinal Rehab. I want to talk a little bit about a study that I remember at a seminar I was at. This was years ago by another chiropractor named Dan Murphy. He talked about a study that was done in Europe on people that were going in to have back surgery. They were doing the study on these people where they actually did local anesthetic, and as they were going into this surgery, they would actually stimulate different tissue layers to try to determine what was the source of the pain. So what they did is they would go in and they would stimulate the skin before they anesthetize the skin, say, does that reproduce the pain that you're having? And then they'd go to the muscles, and they'd cut away the skin, and they'd go to the muscles, and they'd say, okay, does that reproduce the pain? And then they went a little deeper. They went to the disc, okay? And many of these patients were having what's called a discectomy, where they would go in and take a piece of that disc out to take pressure off of a nerve. They'd stimulate that, and they'd say, does that reproduce your pain? And then finally, they went to the facet joint. The facet joint are these little joints in your spine on each side that allow your spine to bend and move. So in your neck, it allows for flexion, extension, rotation, all these different movements. Your lower back, same thing. What they found is that in this study, that the one that reproduced majority of the time was not the disc, was not the muscle, was actually the facet joint. Okay, this little tiny joint is what reproduced the pain that these people were going in for surgery. Okay, so what does that mean for you? Well, a lot of people think low back pain is a strain or a sprain of the muscle, right? Or they think it's a disc, a slipped disc, a herniated disc, whatever you want to call it. Whereas in fact, most of the time it's a facet issue, meaning there's inflammation in the facet. There's improper motion or mobility in the facet. A lot of times that happens because of improper alignment in your spine, and that improper alignment can be caused because of posture. It can be caused because of the way you sleep or whatever happens. But when that gets out of alignment due to those things, it causes wear and tear in there. Okay, it causes inflammation to occur, and then the muscles tighten around it. But the pain is actually produced right here in these little facet joints. And so, to understand that, it's really important to know, okay, if the pain is being produced in the facet joint, what is it that actually can get rid of it the quickest? Well, when we adjust somebody, we get in there and we actually manipulate somebody. A lot of times you go to a chiropractor, you hear things pop. Well, that popping, that cracking is actually releasing, getting motion in those facet joints. And so when that releases, that helps that facet joint to heal, helps it to move like it should, and helps to get rid of the pain. And so that's why chiropractic is so effective for low back pain. And if you read a lot of the new studies out there, a lot of the even in the Journal of American Medical Association, they actually say that alternative therapies are the first step when it comes to low back pain, not drugs or other things like that. But they even say that manipulation is one of the best things that you can do for lower back pain. And so I want to just talk a little bit about that today. If you're having lower back pain, don't suffer with it. Come in, let us help you out. You can get out of pain usually within a visit or two. We know what we're doing when it comes to lower back pain. If you're not sure what's going on, let us check it out, and we can let you know if it's a disc, if it is joint, if it's the facet, if it's muscle. There's ways and there's tests, and we have x-ray. We can do things to help to determine what it is. So if you have any questions, give us a call, 801-492-9300. Again, have a great afternoon, and look forward to talking to you soon.